Hello, amazing people. Welcome back. It's wonderful to have you here. I've prepared a special video, and I truly believe it's going to be valuable to you. Do you experience frequent stomach pain, bloating, or those sudden, unpredictable trips to the bathroom? You might be dealing with irritable bowel syndrome, or IBS for short. Irritable bowel syndrome, a condition that affects millions worldwide, but often misunderstood digestive disorder that affects millions of people worldwide. Irritable bowel syndrome is characterized by symptoms such as abdominal pain, bloating, and diarrhea or constipation, as well as other changes in bowel habits, and it can significantly impact a person's quality of life. The chronic nature of the symptoms, coupled with the unpredictability of flare-ups, can lead to missed work and school days, social isolation, and psychological stress. Unlike some other gastrointestinal conditions, irritable bowel syndrome doesn't cause any structural damage to the digestive tract. This is why it's considered a functional disorder. While irritable bowel syndrome can affect people of all ages, it is most commonly diagnosed in individuals under the age of 50, and its prevalence decreases slightly with age. And in terms of gender, irritable bowel syndrome is more commonly diagnosed in women. In some studies, up to 70% of the diagnosed patients were women. Unfortunately, despite its prevalence, the exact causes of irritable bowel syndrome remain complex and varied, involving a combination of factors such as gut-brain interaction, altered gut motility, imbalances in gut microbiota, and dietary triggers. In this video, we'll break down what causes IBS, explore its most common symptoms, and provide proven tips to help you manage it effectively. To the role your gut microbiome plays, to why some people experience pain and discomfort more intensely, plus, we're talking about how diet, infections, and even stress can all mess with your gut. Whether you've just been diagnosed or have been living with IBS for a while, understanding these 7 aspects is key to managing your symptoms and getting back control of your life. Number 1, gut motility. Gut motility refers to the movements of the digestive system and the transit of the contents within it. These movements are controlled by the muscles of the gastrointestinal tract, which contract and relax in a coordinated way to move food, liquids, and waste through the digestive system. This can lead to diarrhea, constipation, or a mix of both. Many studies were conducted to observe how food moves through the intestines in irritable bowel syndrome patients. It was found that in people with diarrhea-type irritable bowel syndrome, food moved too quickly through the gut, leading to loose stools. For those with constipation-type irritable bowel syndrome, food moved too slowly, causing hard stools. For constipation-type irritable bowel syndrome, laxatives may be prescribed to help with constipation. For diarrhea-type irritable bowel syndrome, medications like loperamide can help control diarrhea. Number 2, gut microbiome. The balance of bacteria in the gut, known as the gut microbiome, may be disrupted in the people with irritable bowel syndrome. Some research suggests that an overgrowth of certain type of bacteria or a reduction in beneficial bacteria may contribute to symptoms. One study published in the Journal of Gastroenterology was aimed to analyze the types of bacteria in the guts of people with irritable bowel syndrome. They found that around 73% of irritable bowel syndrome patients had less diversity in their gut bacteria compared to healthy people. They had more bad bacteria and fewer good bacteria. This shows that an imbalance in gut bacteria might be a big part of why irritable bowel syndrome symptoms happen. Taking high-quality probiotics or consuming probiotic-rich foods like yogurt, kefir, sauerkraut, and kimchi can introduce beneficial bacteria to the gut. Number 3, gut-brain interaction. The gut-brain interaction, also known as the gut-brain axis, is a complex communication network that links the gut and the brain. Abdominal pain is a hallmark symptom of irritable bowel syndrome, often described as cramping or aching. The pain is typically relieved or partially relieved by bowel movement. The brain and the gut communicate through a complex network of nerves, and in people with irritable bowel syndrome, this communication may become dysregulated. As a result, the sensitivity of the gut become heightened. In addition to that, stress and emotional distress can trigger or worsen IBS symptoms. This is because stress influences gut function through hormonal changes, like the release of cortisol, and increases gut sensitivity. In August 2013, a study was published in Neurogastroenterology and Motility to explore how gut-brain communication dysfunction contributes to irritable bowel syndrome. The findings of this revealed that approximately 60% of irritable bowel syndrome patients showed heightened activity in the anterior cingulate cortex, which is a brain region associated with pain perception, compared to 30% of controls. About 70% of irritable bowel syndrome patients exhibited increased cortisol responses to stress, compared to 30% of controls. The study concluded that dysfunction in the gut-brain axis, especially heightened pain sensitivity and stress response. Number 4, visceral hypersensitivity. Visceral hypersensitivity is a condition where the nerves in the internal organs, particularly within the gastrointestinal tract, become unusually sensitive to stimuli. This heightened sensitivity is a hallmark of irritable bowel syndrome, IBS, and contributes significantly to symptoms like abdominal pain, bloating, and discomfort. Essentially, people with visceral hypersensitivity experience more intense pain or discomfort from normal digestive processes or minor triggers compared to those without IBS. Researchers tested how sensitive the intestines are in people with IBS by gently inflating a balloon inside the rectum. About 85% of them felt pain at much lower pressure levels than people without irritable bowel syndrome. Adding to that, brain scans also showed that their brains reacted more strongly to this pain. This means that people with IBS feel more pain from normal digestive processes, which might explain why their symptoms are so uncomfortable. Number 5, post-infections irritable bowel syndrome. Post-infectious irritable bowel syndrome, PIBS, that develops after a person experiences a gastrointestinal infection. This infection could be caused by bacteria, viruses, or parasites, leading to symptoms like food poisoning. Researchers looked at people who developed IBS after having a gut infection like food poisoning. After analyzing the data collected, it was revealed that people who had a gut infection were 6.5 times more likely to develop irritable bowel syndrome later on. About 10% of people who had these infections ended up with irritable bowel syndrome. This shows that sometimes irritable bowel syndrome can start after an infection messes up the gut, leading to long-term symptoms. Number 6. Psychological factors. Psychological factors play a significant role in irritable bowel syndrome and are often closely intertwined with the onset, intensity, and persistence of symptoms. The connection between the brain and gut is highly complex, with psychological factors such as stress, anxiety, and depression having a direct impact on gut health through the gut-brain axis. Stress triggers the body's fight-or-flight response, causing the release of stress hormones like cortisol and adrenaline. In people with IBS, this can lead to changes in gut motility, either speeding up or slowing down digestion, and increased gut sensitivity. Fortunately, treatments such as cognitive behavioral therapy, gut-direct hypnotherapy, and mindfulness-based stress reduction have been shown to reduce symptoms in some IBS individuals by addressing the psychological aspects of the condition. In addition to those, techniques such as yoga, meditation, and regular exercise can help manage stress and reduce the severity of irritable bowel syndrome symptoms. Number 7. Dietary factors. When it comes to IBS, what you eat can greatly influence how you feel. Certain foods can trigger symptoms such as gas, bloating, abdominal pain, and irregular bowel movements, while others can help to calm the digestive system and provide relief. But it's not the same for everyone. For some, high-fiber foods like beans, broccoli, and cabbage cause chaos, while others might react badly to dairy, fried foods, or spicy dishes. One of the primary dietary concerns in IBS is a beginning of FODMAPs, which are short-chain carbohydrates that can be difficult to digest. Examples of these foods include foods like onions, garlic, and apples. Conversely, beverages like carbonated drinks, alcohol, and caffeinated beverages can contribute to bloating and increased gut activity, exacerbating IBS symptoms. Not to mention, some people with IBS may have specific food intolerances, such as lactose intolerances, which can exacerbate symptoms. A recent study tested whether a low FODMAP diet could help IBS patients. According to the results, about 76% of patients on the low FODMAP diet had less bloating and pain compared to those on a regular diet. Many patients benefit from following a low FODMAP diet, which involves reducing the intake of fermentable carbohydrates that can cause bloating and discomfort. Furthermore, soluble fiber supplements such as psyllium can help manage constipation predominant IBS. However, watch out because insoluble fiber found in foods such as beans, nuts, and whole wheat flour may worsen symptoms in some people. So, this was the simple explanation of irritable bowel syndrome. The symptoms can be managed effectively through a combination of dietary changes, lifestyle modifications, and medications. While it can be challenging to manage, understanding the condition and working closely with doctors can help individuals control their symptoms and improve their quality of life. Now, we want to hear from you. What dietary changes have made the biggest difference for you in managing IBS? I just want to take a moment to genuinely thank you for being here and watching. I hope you found the content useful and enjoyable.